Here are some handouts with key points of my proposal so you can follow along. Hello, my name is Sandy McDevitt and I'm a senior in the CLS program at Winston-Salem State University. My research proposal is increasing the validity of stored red cells with supplemental dextrose. The storage lesions can cause numerous changes to the red cells in storage. These storage lesions can cause multiple side effects to the transfusion recipient. Since it is not always possible to give fresh blood, these lesions need to be eliminated for a favorable outcome. I hypothesize that by maintaining an energy source, dextrose, the red cells will remain viable for 120 days. When red cells are in storage, numerous changes occur to those red cells called storage lesions. The longer the storage, the more effect the storage lesion has on the red cell, causing the red cell to deteriorate over time. As stored red blood cells age, its energy sources are depleted, resulting in reduced structural integrity of that membrane. As a result, stored red cells become less flexible and more fragile as they age. Some of the most studied and well-known of these lesions are increase in hemoglobin and potassium, as well as a decrease in pH, ATP, and 2,3-DPG, which in turn will decrease the oxygen carrying ability of that red cell. There are also changes to the morphology of the red cell, such as schistocytes, which will decrease the red cell's ability to maneuver throughout the body. You can refer to your handouts and you can see the diagram here and do a detailed illustration of the impact that storage lesions has on the oxygen delivery. We all know that transfusion of red cell is a life-saving therapy for critically ill, surgery, and trauma patients. According to the American Red Cross, there's a need of more than 41,000 units per day. To support this, there are 9.2 million volunteers donating over 15 million units of blood each year. Now, traditionally, red cells units are utilized as a first-come, first-served basis. But sometimes smaller hospitals will ship older units to higher volume users like trauma centers for best blood usage. Occasionally, during natural disasters, the demand can dramatically increase, making the utilization of these units even more of a concern in transfusion medicine. With all of the proven storage lesions, it does appear that transfusion of fresh blood, now that is blood that is less than 14 days old, would give the patient the most benefit from that transfusion. But therein lies the problem. There is no way to manage the amount of blood collected to give patients fresh blood. Always give them fresh blood. Therefore, one needs to keep the irreversible storage lesions from occurring in the first place. For almost a century now, researchers have sought to come up with the perfect combination of anticoagulant, pHs, and additives to collected red cells to make them remain viable for the entire storage life to support the usage. But over the last 50 years, researchers have been putting all of their research into increasing the storage life of red cells to reduce the waste. They have taken that basic CPD preservative to test additives and different combinations to make the storage life up to 42 days presently. But none of these will keep the ATP levels consistent throughout that entire 42 days. they only keep the hemolysis within the FDA's requirement of 1%. With that being said, a method of preservation is needed to preserve red cells to make them as viable on day 1 as on day 121. Our patients deserve a favorable transfusion outcome. Because of the enzymatic activity of hexokinase and phosphofructokinase in the glycolytic pathway, ATP is used up rather quickly. When using a low pH, ATP can be generated on down the glycolytic pathway, thus maintaining ATP concentration, but only for the first 14 to 21 days of storage. I hypothesize that with the addition of dextrose at different intervals, ATP levels will be maintained, giving the red cells extra energy needed to be viable for 121 days of storage, without those detrimental storage lesions. In my study, I will have 2 healthy 25-year-old men volunteer to have their red cell units used for the storage study. Both men will meet all of the requirements set forth by the American Red Cross for allogeneic donations. 450 mLs of whole blood will be collected from the men with 63 mLs of CP2D anticoagulant and its preservative, including 3,220 milligrams of dextrose. A pediatric 150 ml 6-bag aliquot system containing a mixture of 3,220 grams of dextrose and 10 mLs of saline will be sterile docked to one of the red cell units. The other unit will be used as a control and dextrose will not be added to it. All units will be stored in a Helmer refrigerator, just as this one in the picture, and will be tested at day 1, 21, 42, 60, 80, 100, and 120 for pH, ATP, potassium, glucose, lactate, hemoglobin, hemolysis, and morphology. After the samples are collected on day 20, 1 aliquot bag of dextrose mixture will be allowed to free flow into each red cell unit, and the cycle will repeat itself 5 times. Results are projected to show consistent normal levels of all tested parameters. In conclusion, this study will show the possibility is there to increase the storage life of a unit of blood to 120 days. I believe this study is the first step in the research of its kind. The next step would be to treat murine red cells as in this study, transfusing those red cells to mice, testing at the same intervals for viability, then leading into human trials. The ultimate goal is to transfuse the patient with the most viable red cells possible, no matter what the age of that unit is, resulting in the best outcome possible without any waste. I would like to thank my editor-in-chief, my husband, Ricky, who read so many pages and corrected so many words and sentences he feels like he could do the lecture on storage lesions. Everyone, thank you for taking the time to listen to me, and also for your consideration of any funding for my all-important proposal of increasing the validity of stored red cells with supplemental dextrose.